Greeting all, welcome to another topic of physiotherapy, physio TV session today. And we have Dr. Sandesh Sakpal sir, Assistant Professor from the KJ Somia College of Physiotherapy in Neurophysiotherapy Department. Sir has completed his bachelor's from CMF College of Physiotherapy and master's from SKN College of Physiotherapy. He has also done MA in Yoga Shastra from Padma Yoga Terna College. Sir has also published several papers in renowned journals. He is currently pursuing PhD scholar degree. And sir, we are very grateful to have you in today's session. We are actually looking forward to learn from you, and it is a great opportunity for us. So, sir, I'm handing over the session to you. Please enlighten us with the knowledge.
Thank you so much for the introduction. Greetings of the day. I take the opportunity to go ahead with the session, and thank you so much for inviting me. And I take opportunity to thank my all the mentors, my guides, my mentor Dr. Parag Ranade sir, for whatever knowledge I am there today. I am going to share. It's because of their all contribution. And I'm not the expertise of this topic exactly, but yes, whatever I could have gained through the knowledge, I shall share with you all. So the topic for the today's presentation is neuroanatomy and neuroimaging for physiotherapy students. So basically, to start with the brain anatomy, to know the neuroimaging better, you should know the neuroanatomy first, better way. So here we can see the brain in 3D image. So this image will are proper. Mainly the brain is divided into frontal lobe, parietal lobe, occipital lobe, and temporal lobe. Second is the temporal lobe. Then the hindbrain, cerebellum, pons, medulla oblongata, and spinal cord. So we have different fibers in the brain, mainly the commercial fibers and the association fibers. So association fibers will be connecting to the same cerebral structures within the same brain hemisphere, and the commercial fibers will be the corpus callosum will be connecting with the two hemisphere. So to know the function of the brain, mainly the higher cognitive functions. So frontal eye field for in a frontal lobe, we have a conjugate eye movement, then voluntary movement by the primary cortex, primary sensory cortex for sensation, then language for the body case and the sensory language. The motor will be the Broca's. Memory will be by the temporal lobe, the medial temporal gyrus and the hippocampal area, and the vision will be by the occipital lobe, and balance and equilibrium will be by the cerebellum. So we have homunculus representation of the body, which is upside down. Now the homunculus representation has been changed. So we have a new homunculus representation as well. This is the old one. So we can see the sensory and motor. So we have maximum representation of the thumb, and lower limb are represented inside the two hemisphere, whereas the face is outside the superior lateral surface of the brain of the motor cortex and sensory cortex. We can see here. So this is very important to know whenever we see the infarct, so which part of the brain get impaired, that is according to the area it's got the infarct. Then we have gyrations, different gyrations, the elevation and the sulcuses in the brain, the depression in the brain. So mainly are the central sulcus. In front of we have precentral gyrus and postcentral gyrus, which are very important to know. Then we have superior sagittal, superior frontal gyrus, middle frontal gyrus, and here we can see all. So I'm not going in depth into that. Then we have the primary motor area. Then we have supplementary motor area, premotor area, which are there for the motor planning. And later we go ahead, you can see the different Rodman's classification to different cortexes. So now going ahead, we have frontal lobe, parietal lobe, temporal lobe, and occipital lobe. You can see here. In between the frontal and temporal lobe, if we go inside, we have an insular lobe. So insular lobe is very important to know in a MRI, I can say, because the insular lobe in MCA territory infarct, basically the insular lobe we get, the ribbon shape of the insular lobe gets impaired first. So we can easily locate where the part of the brain and surrounding structures. Here we usually see the midbrain structures, the basal ganglia structures. So this insular cortex, to know it's a group which separate the frontal lobe and temporal lobe adjacent to the thalamus. So we see the basal ganglia structures here. So whenever we see if you can locate the insular cortex in the brain, then we can totally correlate the basal ganglia structures. So if the insular cortex get dysfunctional, so these are the problems which the patient suffers. Then the brain blood supply, which is very important to know, because the territory of the artery, wherever we see in MR angiography, which I will be covering here a short part. So where we can see that it is covering the blood supply of the brain. The circle of Phillips should be known to you. So two vertebral artery combined to form the basilar artery in the front of the pons, then divided into PCA. Then the inner blood supply will be provided by the ICA. Then the ICA will be divided into two, MCA and the ACA. And the ICA, the internal carotid artery, is connected by the PCA by the posterior communicating artery. So it completes the circle of Willis. So this is very important to know. Then the blood supply of the brain. So superior lateral surface, the majority part which is showing here red in color is by the MCA. The posterior part we can see, which is blue in color, by the PCA, and yellow in color is the ACA. So ACA, this is a medial surface, this is the lateral surface. So medial surface mainly supplied by the ACA. So therefore we see the ACA patient shows the lower limb more affected than the MCA. We show majorly the upper limb and the face are more affected. So these are the pyramidal tract. We can see the pyramidal tract bed cell. So it goes to the posterior limb of internal capsule, then it go ahead and crux cerebri, then it crosses at the medulla and continues the lateral corticospinal tract. We have different descending and ascending tracts to just revising fast. So corticospinal, anterior corticospinal, corticobulbar, rubrospinal. These are the descending tracts or the motor tracts, and we have vestibulospinal tract, reticulospinal tracts. Then we have ascending tracts, which are sensory part, mainly the fasciculus cuneate and gracilis. We call it as dorsal column tracts, lateral spinothalamic, anterior spinothalamic, and spinocerebellar tract. Another main structures we know is the reticular activating system, which is present in between the midbrain pons and medulla oblongata, which activates your brain. So it is a switch off and on button of the brain, which gives sensory inputs to the thalamus and then brain activate. So this is a switch off and on button of the brain, the reticular activating system. Then these are the tracks. I'm just skipping this part. Then we are coming towards the CSF flow. So again, this is important to know, because in hydrocephalus, CSF is obstructed hydrocephalus. It will cause the dilatation of ventricle. So how the CSF flow exactly? Created in corpus choroid plexus in the lateral ventricle, then it will go to the third ventricle. Then it will the third ventricle to fourth ventricle by aqueduct of Sylvius. Then fourth ventricle, it will come into the subarachnoid space by the foramen of Luschka and Magendie. Then it will go down, it will pass to the central canal, it will come ahead and up the brain in superior sagittal sinus, it will absorb in a subarachnoid villi. This is how the CSF flows. So now the lateral ventricles, foramen of Monro open into the third ventricle, aqueduct of Sylvius open into the fourth ventricle. So fourth ventricle is exactly in front, behind the pons, and exactly in front of the cerebellum. This is another structures to know to regional anatomy of the MRI of the brain. So in MRI, exactly what happens? There are several sections we can see, or CT scan, we can see the several sections. So you should know which structure to identify, and then only you can realize which part of the brain we are at. So venous supply, we have a sinuses, suprasagittal sinus, that transverse sinuses and sigmoid sinuses. So which will the venous part of the brain supplies the venous area. So superior sagittal sinus, we have inferior sagittal straight sinus, then we have sigmoid sinus. So this will cover the our venous sinuses of the brain. Now we come towards the anatomy of the MRI and the brain, how the commissure fibers and association fibers. So these association fibers are the axons which covers one part of the brain to the other part of the brain in the same cerebral hemisphere, and commissure fibers will be axons will covering the two hemispheres. Okay, so now here when I get the axial section, the frontal section of the brain, where I can see the two hemispheres are connected by the corpus callosum. We can see in the center, this is a ribbon-like structure, which is the insular cortex. We can see. So beside the insular cortex, we usually see the basal ganglia structure. So that is your caudate nucleus. Caudate nucleus just besides the lateral ventricle. Then we have thalamus and putamen and globus pallidus, the lentiform nucleus. From here, the posterior limb, we see the pyramidal fibers are going. That is the corona radiata. So we can see the pyramidal fibers are going from here. So here in digital anatomy, we can see the brain. So brain, the outer part is a gray matter. The inner part, which is made up of the axon, is white matter. So whatever we see inside is a white matter. Whatever we see outside is a gray matter. So this is a gray matter, and inside we have a white matter. So we come to the next section where we can see the gray matter. Gray matter is outside. We can see the white matter, which is coded with the different color pencil, so that we need to understand these are the axons which are covering the one part of the area to the other part. So these are the association fibers which covers the hemispheres, and commissural fibers which covers the two hemispheres. Then projection fiber which are be going out from the brain. So we have this blue color zone is your ventricles. Besides the ventricle, we have a wolf of eyes, known as caudate nucleus. Then beside that, we have down, we have thalamus. Between the thalamus and caudate nucleus, and this part is known as a R lentiform nucleus, that is your putamen and globus pallidus. In between this, we have an internal capsule. You can see this is the internal capsule or gangliocapsular region. Beside that, the ribbon-like structure is your insular cortex, then temporal lobe, and we have a frontal lobe. Okay. So we are at a temporal lobe and frontal lobe. So here this is a part of brain. Again, we can see the gray matter, white matter. This is a ventricle. So this is a ventricle. You can see the exact image of the brain. Whatever we have learned right now, there is a frontal section. So whatever is a hollow space is your are ventricles, the lateral ventricles, two lateral ventricles. They are septum pellucidum, you can see here. Then we have beside the ventricle, we have caudate nucleus. Below the caudate nucleus, we have thalamus. This is the thalamus. In front of the caudate nucleus and thalamus, we have a globus pallidus. In between it has a internal capsule. Okay. So this is structure and this is the insular cortex. Then in a sagittal section, we can see the brain. Here again, we have to locate the part of the brain. This is the frontal lobe we can see here. Then the ribbon-like structures, if we are seeing here, this is the insular cortex. Then we have parietal lobe. Behind, we have occipital lobe. This is a lateral ventricle. And this is corpus callosum, which is connecting the two hemispheres. Beside the lateral ventricle, we have the caudate nucleus. Below the caudate nucleus, immediately we have thalamus. And in front of that, we have lentiform nucleus, the putamen and globus pallidus. And between, we have the internal capsule. So here, we can see now again the brain anatomy, the section of the brain. Here we can see this is a corpus callosum between the two hemispheres. This part, whenever we see this part, this is a R ventricles. So you can correlate easily. These are the ventricles. This is caudate nucleus, the eyes. Down we have thalamus, and this is our putamen and globus pallidus, and in between we have internal capsule. Beside it has a insular cortex, and down we have a occipital lobe. So how it is important to know? So take an example, the homunculus representation of the body. So these fibers passes from the different bed scale to come towards the projection fibers and goes down. So beside the ventricle, if there is a dilatation of the ventricle or periventricular ischemic changes are there, it will damages your periventricular area, mainly has a lower limb area. So whenever we see this, so in periventricular leukomalacia or periventricular issues, which the lower limbs are more affected. So in spastic diplegic, we see this. So whenever we have to be very cautious to know the periventricular area is damaged or not. Then we have seen this. So areas is affected. Accordingly, we see the affection of the brain. So mainly the hemiplegia, we see the one side of the body. In diplegic, we see the periventricular area is affected. This section we have seen. So there are different commensal fibers and association fibers are going one part of the brain to the other part of the brain. This is the internal capsule. This is ribbon-like structure is again insular cortex. Then we have frontal lobe, parietal lobe, occipital lobe. Okay. So here we'll start with the MRI of the brain. So this is related to the regional anatomy of the brain. Now we go ahead with the MRI of the brain. So MRI of the brain, so transmitted, it is magnetic field which receives a magnetic resonance and which creates the images which can be visualized to us. So there are T1 weighted, T2 weighted according to the phase of the cycle. We see it. So I will not go into the detail of it. But to know, we have sagittal images where we see the brain from the sagittal view. We have axial images in transverse plane and we have coronal images. So the sagittal images, mainly we will look for the central part is corpus callosum. The inside we have a lateral ventricle. This is a frontal lobe, parietal lobe, occipital lobe, cerebellum, the tree-like structure. This part is known as midbrain, pons, medulla oblongata, and spinal cord. So this is the imaging. In axial section, we see that it is taking a section through the transverse plane. So we can see the eyeballs, the nasal septum. We can see the hippocampal area. This is at eye level. So this is at the brain, the basal brain area, where we see mainly the pons, midbrain, and other structures, and hippocampal area and posterior part of the brain. So this is axial image, and coronal image will be the frontal plane images where we can see the lateral ventricles and others. This area mainly for the pituitary affection or pituitary part, and cerebellum can be visualized properly. So when I go from the starting of the brain section, mainly we have central semi-oval. It starts from the central semi-oval where the pyramidal tract starts and corona radiata. Then we see the precentral gyrus, precentral sulcus, precentral gyrus, the central sulcus and postcentral gyri. And frontal, we have parietal lobe and then we have a occipital lobe initially. When we go down, then the parietal lobe disappear and we have a temporal lobe and insular cortex. And we go down, we have basal ganglia structures. Later we have midbrain, then we have pons, then we have the cerebellar and other part of the area. So this is a central semi-oval. So this is central semi-oval. Whatever is outside, we have, this is known as a gray matter. Whatever is inside in the brain is known as a white matter. This is a in between the two hemisphere. So this is a fat and skin. When we go down at the midbrain, this is a frontal lobe, parietal lobe, and occipital lobe. When we come down, we see this is a temporal lobe coming. Now this is the insular cortex. This is a two ventricles of the lateral side, the anterior limb, the posterior limb, and this is opening into the third ventricle. So now this is a frontal lobe, occipital lobe, parietal lobe, and this is temporal lobe, and inside we have a insular cortex. Beside the insular cortex will be the basal ganglia structures. This is a caudate nucleus. Down we have thalamus. Then we have here is your globus pallidus, and in between it is a internal capsule. The internal capsule, posterior limb, anterior limb. Posterior limb carries your pyramidal tract. When we come down little bit, then we see a Mickey Mouse like structure which is known as a midbrain, the crux cerebri, cerebral peduncle, and here we can see the cerebellum, the hippocampal area, the occipital lobe, and frontal lobe can be seen here. So this is a regional anatomy where we can see the Mickey Mouse like structure is midbrain to remember, and you have cerebral aqueduct. At the eye level, where we can actually see the pons and midbrain structures. The pons, we can see here, this is a pons, the oval shape structure. Here we can visualize this is a Mickey Mouse. It is a pons. In front of a pons, we have basilar artery, which is not seen here because T1. This is a different image, so I will show you later. This is a fourth ventricle. Just behind the pons, we have fourth ventricle, and behind it has a cerebellum, and this is a temporal lobe. Now we have T1 weighted images, as I said, T1 weighted, T2 weighted, and diffusion weighted images and flare images. So what is it all about? So how to identify on MRI? So MRI, we can see the T1 weighted images where the CSF is black always. So you can see the any fluid material is black. The fat material is, the fat on the scalp is white. The white matter of the brain is slightly white as compared to the gray matter. So whichever has a fluid or whichever has fat will show the white in the will show the water content will be there, that is your CSF in the ventricle will be look black in the T1 weighted images. When we go for the T2 weighted images, the T2 weighted images, we can see the fluid is white, that is the CSF will be bright white. The brain white matter will be the gray, and brain gray matter, the gray matter here will be a light white as compared to the white matter. This is for T2 weighted images are mainly look for the edema and everything. The diffusion weighted images for scanning for the stroke images and abscess. The diffusion weighted images will be there to know the extent of infarct and everything. So that the CSF will look the dark and the brain white matter will look the gray, and white matter will look lighter than the white. Brain gray matter will be a lighter than the white matter, and white matter will be the gray. White matter is gray and gray matter will be the lighter than the white matter, and fluid will be the CSF will be the dark. And you can see the brain image is highlighted. So here to understand the diffusion weighted images and normal this. So this is a normal brain, normal diffusion. If there is a diffusion restricted, you can see the infarction, it will be higher, intensified. The image will be seen in diffusion weighted images. If the diffusion is restricted this side, then we can see here the ventricle, the lateral ventricle. This is a lateral ventricle, exactly upper part. So I'll go the region wise anatomy now. So this is how it looks at the front. So if I see the section at this level, this is the upper part of the brain where this is the axial image. So T2 weighted images, because you can see the fluid here. This is a CSF in between the gyri. So here is frontal lobe, parietal lobe, occipital lobe in between the two hemisphere. We have a precentral gyrus. This is the central sulcus, the center part. Then postcentral sulcus, postcentral gyrus. Then suprasagittal sinus is here behind. These are the important anatomy we should know. When I come down little bit at this level, we can see the lateral ventricle. So this is the lateral ventricle we can see here. Still, here we have a frontal lobe. Then here we can see a bit of basal ganglia structure. This is a caudate. Then we have a thalamus here. Beside the lateral ventricle, we have a corona radiata. We can see the corona radiata beside the lateral ventricle. This is the periventricular area, we can say. This is the periventricular area. So now we go ahead with the lateral ventricle again at the midbrain level. At the basal ganglia structures level, we can see here the T2 weighted images where the why T2 weighted image, because the CSF is white here. So this is the lateral ventricle. So you can see the CSF is white. Then these are the structure of the lateral ventricle. Beside we have a caudate nucleus. So whenever you see this structure and whenever you see this ribbon-like structure is insular cortex, this is a caudate nucleus. We have globus pallidus, and this is a thalamus. In between we have a anterior limb, the genu, and the posterior limb of the internal capsule. Behind we have a occipital lobe. So this is all about. Then we go ahead little down at the eyeball level. So this is the eyeball because it has a fluid, vitreous fluid. So we can see the the eyeball is white. Then again, this is a Mickey Mouse like structure. So this is a midbrain. We have a gray line here, which is substantia nigra, cerebral peduncles. The aqueduct of cerebral aqueduct is seen here. So these are the structures to important and understand. When we come down, this is a oval shaped structure. We can see here, this is a pons. Behind the pons, we have a cerebral aqueduct. We have cerebellum immediately behind that. This is hippocampal area. Then we can see in front of pons, as I said, there is a basilar artery. Basilar artery is here. When we go down a little bit at the pons level, then we can see the pons and the aqueduct fourth ventricle properly and cerebellum. When we can see the cerebellar area. When we go down, we can see the nasal septum. The eyeball as the eyeball is not visible right now. So at the nasal septum level, we can see the pons. The vertebral arteries can be seen here, the cerebellum, everything. So this is a frontal section again. So we can see the midbrain, pons, medulla oblongata. This is a corpus callosum. This is a septum, the lateral ventricle we can see. This is a frontal, parietal and occipital lobe and cerebellum. When we come down again, just here we can see the sella turcica where pituitary gland is visible here at the frontal section. And so we have covered this. So now go ahead. Let's go ahead with the other part of the brain. So this is a Mickey Mouse like structure. So you should understand this is a midbrain. And optic chiasma will be seen here because in front of the eyeball it is crossing. So these are so you should know the anatomy clearly so that you can identify the structure very well on the MRI. So three section, as I said, axial, sagittal and coronal section. So T1 weighted images, the fluid will be black. T2 will be the fluid will be white. So diffusion weighted images, you can see the diffusion. If there is an abnormal disorder, it will be hyperintense. So this is an infarct. You can see the impact in diffusion weighted images. So we can go with the abnormal pathologies can be detected on the MRI. So whenever we see this is a CT scan because the brain structures are not visible properly. So this is the soft mat, the soft tissue as compared to here. This is here we can see the normal ventricles size. Here we see the dilated ventricle. So this is a hydrocephalus. We can see the hydrocephalus here as well. So this is hydrocephalus because this is the lateral ventricle we usually see, which is dilated. And we have here corona radiata. So it will be compressing the corona radiata, the pyramidal tract. So when we come down, we can see an encapsulated localized area. So this is with a regular shape and a proper capsule-like structure. So this is a astrocytoma. So this is a tumor inside the brain. So T1 weighted images you can see here, T2 weighted images you can see the hyperintense image of the same tumor. So these are the tumor. Tumor will be usually seen with a hyperintense image with a proper capsule or encapsulated area with margins properly. So when I come here, so here a first image is diffusion weighted images where we can see the diffusion and hyperintense area. So B is flare image and C is a T2 section. So where we can see the abnormalities in A section, we can see the hyperintensity at the left side. So this is left side and this is right side. Whenever I see front, on my right side it's always brain's left side, on my left side brain's right side. So here is the left side of the brain. We can see the periventricular area is a hyperintensified structure which indicated a infarct in the periventricular area. Then here, so come here, when we come third images, we can see that this is a pons structure, this is a cerebral aqueduct and cerebellum. So in front of the pons, we can see that this is a left side, our right side always the left side of the brain and left side will be the right side. On right side, you can see the hyperintense area in the pons. So which is again shows ischemic changes in the pons. When I come ahead with this, so how to identify the stroke? Again, so we should know the territory of the artery supplying the that part. So here, this is the insular cortex. We can see here a image of the middle cerebral artery of the CT scan. So how it is seen? So this is a whenever we see a insular ribbon like structure is get impaired. So this is a MCA territory infarct. A large distribution in MCA territory because it is compressing the gangliocapsular region also and it is compressing the lateral ventricle. When I see the B section, the anterior part, the frontal lobe, which is supplied by the anterior cerebral artery. So lateral part is supplied by the MCA, the anterior part is supplied by the anterior cerebral artery. So we can see here the hyperintensity in the medial part of the frontal lobe. So this is the left side of the brain. This is the left side frontal lobe infarct. Coming to the C section, I can see the flare image where the left side of the cerebellar hemisphere shows the hyperintensities, which shows there is an infarct in the left side cerebellar hemisphere. When I come down, so see the structures anatomically. So when I come this section, we can see this is a Mickey Mouse like structure. So around that we have a hippocampal area and everything, and occipital lobe. So we can see the hippocampal and occipital lobe is having the ischemia. Coming to here, we have always seen here this part is always thalamus. You can see the thalamus is again showing the infarct. So this part is supplied by the PCA. So this is the PCA territory. Infarct. So we come ahead with this. Again, we can see here the images. This is CT scan. So this is a pons because this is a oval shape. This is a midbrain because this is a Mickey Mouse shape. So here we can see the infarct in the occipital lobe again at different images of the T1, T2 and CT scan as well. So this is a acute to chronic. You can see the changes. These are the changes in the parietal lobe. That is again showing the infarct in the parietal lobe at T1 flare and CT scan. Then how to identify the bleed on the MRI and CT scan. So how to identify this is a CT scan because the brain structure is not clearly visible as compared to here. You can see here the brain structures are clearly visible. This is a MRI. When it is not clearly visible and the bone is hyper intensified, then it is a CT scan. So here CT scan showing the CT scan and MRI basic difference is MRI is done. CT scan is done immediately because it identify the bleed easily faster as compared to MRI. This is the advantage of MRI. MRI takes time, and if there is any metal implant, then MRI is not indicated because it will have magnetic disturbances and it is contraindicated for the MRI. Any metal implant, anything. So CT scan is X-ray images of the brain. So we can see here the early bleeding can be detected, hemorrhage can be detected on the CT scan. The CT scan, the bone will be brighter, and there is house field units in the CT scan to measure the any field. So I will cover this in this lecture. So in CT scan, we can see here this is a this is irregular shape in the distribution of the artery supplying to the brain. So this is a part of the insular cortex. We can see this is a anterior limb of the lateral ventricle, posterior limb of the lateral ventricle, and third ventricle opening into third ventricle. This is a section we can see. Beside this structure, we have caudate nucleus. Here we have putamen and globus pallidus, and down we have thalamus. So this is a gangliocapsular area where we can see the bleed is there because it is a hyperintensified, irregular in shape, and in the distribution of the artery. So this is a MCA territory. Hemorrhage, intracerebral hemorrhage can be seen in the CT scan. So you can see here again. So when we go ahead with the hemorrhage, so it is hyperintensified here. It is exactly in the posterior limb of the internal capsule. You can see here, this is the anterior limb and this is the posterior limb. So it is again affecting the thalamus. So down we have thalamus, we have caudate nucleus, we have thalamus and globus pallidus. So it is again gangliocapsular bleed, and again it is affecting the thalamus here. This is again a bleed because it is irregular shape first is, and it is in the distribution of the artery. So acute to subacute hematoma can be seen here in T1 weighted images in CT scan. So A, and we can see the right gangliocapsular bleed again here, the hematoma. The hematoma is hyperintensified here. So T1 weighted images can be seen. Then we go ahead with the this is a D section. You can see the T2 weighted images are hyperintensified area, but you can see the bleeding properly. When we come to the next slide, we see the different section of the brain here. So when I go from here, this is a skull. Skull, we come to the, this is the central semi-oval. As I said, this is central semi-oval. I can see the hyper-intensified structure here between the hemisphere. So this is again, the plaques are seen, different plaques are seen. Then it's open. When I come down, we can see the lateral ventricle. So this is the lateral ventricles. When I come little up, the lateral ventricles are visible more, and corona radiata is visible. Now come the lateral ventricles now opening into the third ventricle. So anterior limb, posterior limb, and opening into the third ventricle. So it is opening into the third ventricle. Here I can see the caudate, the globus pallidus, and here I can see the thalamus, and this is the insular cortex. So this insular cortex can correlate. This is the basal ganglia structures. I can see the hyperintensified structures in the white matter. So this is the white matter because outer we have gray matter, inside we have white matter. So white matter affection, and this MRI suggests of this patient is having white matter plaques, which can be a MS, multiple sclerosis, in this patient. So here we can see the different plaques, different level. But this is a T2 weighted images. This is a T1 weighted images because here we can see brain. This is the frontal images, frontal lobe images, where we can see the hyperintensified structures are here. So I will stop here. We shall be continuing next lecture with the CT scan and everything. Thank you so much, everyone.